We all know about the early setbacks with the rollout of Obamacare, but here it is today. We have a number that no one thought we could arrive at a few months ago. As you know, the announcement from the White House came while I was in my caucus meeting, but it's about 7,050,000 plus 800,000 or 900,000 on state exchanges. Plus, we're going to have 2 more weeks to get the real number. So you can do the math as well as I can. People are hungry for the benefits of this law. Yesterday, there was almost 5 million visits to healthcare.gov and 2 million people for health insurance to the call centers. So all around the country, we witnessed long lines of people wanting to sign up for health care. Take in Nevada, for example, Cashman Field, where they play AAA baseball. People were lined up around the block, and it's a big block, to sign up. And the Nevada exchange hasn't been doing wonderful. The rollout there went a lot longer than the bad rollout here. But the governor, Republican governor, was very courageous and did it, and to his benefit. Xerox, who they hired to do this, were a disaster. But in spite of that, people were lined up for more than a block to get the benefits of this law. The Affordable Care Act, whether my Republican friends want to admit it or not, is working. Americans, as we know, now a majority of them approve the law. And remember, a number of people who don't approve it because it's not strong enough. Despite the clear evidence that this law is helping millions and millions of Americans, Republicans are still talking about repeal, full repeal. And I have to say, they put their legislation where their mouth is. They've tried to repeal it 60 different times. Each time led to the same thing, failure. Now, are the Republicans saying they were going to take all these benefits away from Americans? On the floor this morning, Dick Durbin gave a stunningly emotional statement. He was back here going to school. He was married. They had their first baby. His little girl, who I heard about her for the first time I met Dick Durbin in 1982, had a heart condition from the time she was born. So he goes into this facility here in Washington. They say you have 3 choices: declare bankruptcy, go on welfare, or you can owe it to us and pay us back later. He took the 3rd choice. And it took him and Loretta a long time to pay it off. We're not there now. That's what this is about. We've made progress since Senator Durbin and Loretta had that baby girl, who, by the way, died when she was about 40 years old or thereabouts, from her heart condition. We know at least about 5 million people who were previously uninsured are now on Medicaid. Do Republicans want to repeal that lifeline to these people? That's a question. 3 million people were previously unable to be on their insurance of their parents. They can now, 3 million people. Are Republicans telling them, no, you can't have that? And we could go over line over line of how people with disabilities, etc., are benefiting. I'm willing to work with anyone who wants to try to fix the health care law. But we can't negotiate with a Koch-driven party that's focused on a campaign of full repeal. They need to get real. They need to get real, and if they want to work with us, we're happy to work with them. You know, what people don't realize, there have been changes with the Affordable Care Act a lot. Remember the 1099, we did that. We worked together on that. One of the rare occasions that Republicans were willing to work with us. Just yesterday, when we passed the doc fix, we repealed the cap on small group deductibles. Even the Chamber of Commerce and the Restaurant Association endorsed that change. So we're going to pass another as part of the unemployed insurance program. It deals with volunteer firefighters, a provision that Senator Warner has worked on. So there are changes being made, but the Republicans have to get over. They hate Obamacare and are going to repeal it. Think what this would do to millions and millions of Americans.
Democrats are running on that pledge to fix Obamacare, don't repeal it. Which are the other parts of Obamacare that you need to fix, and what bills would you bring before?
I've mentioned some just now, and we're willing to work with Republicans. A number of Democrats have introduced various bills. Some of them are good, some are not so good, but they're still waiting for Republicans to work with them. That's the problem. We don't have Republicans. They want this thing repealed. They don't want to fix anything that may be made better. Yes? I would hope so. I would hope so. I believe that. Anything we can do to let people know that we're not deaf to issues that may come up. This is a big bill. And if we had working partners, as we used to have with the Republicans, there are other things we could do to work on this bill. But they have been determined to do nothing. Remember, 3 days after Obama was elected, they said that we're going to keep him from being reelected, and how we're going to do that is oppose everything the Democrats want, and that's what they've done.
Senator Reid, since a lot of these bills, as Chuck Schumer said, they put policy and politics together, you're kind of having a debate on the Senate floor about the future. Can you give the Republicans a few more of their amendments to even just perhaps move that debate along?
The unemployment, we tried that lots of times. There are some things that we have in the unemployment bill that's before the floor that have been brought to us by the Republicans. So we now have unemployment insurance again. They want even more. Now, what do they want? We've been told by Republican staff they want to do a lot of things dealing with Obamacare. They want to get rid of a number of EPA regulations. I mean, this is not. Let's work together to try to improve a bill. What they're trying to do is follow the line of the Koch brothers, get rid of all regulations, because those regulations get in the way of the Koch brothers making more money. You know, I said on the floor something that was probably wrong this morning. I said they're the fifth richest in the world. The truth is, if you add the two brothers together, they're the richest in the world. And they are, the Republicans are following whatever they want. I come and speak against them. There's a mad rush for Republicans to defend these oil barons.
Senator, there's talk about releasing Jonathan Pollard as part of these negotiations. What's your feeling about that?
As I had a meeting with somebody from the administration yesterday down in the classified room. As I understand it, he's been in prison now 27 years, I think that's right. And all you have to do is read the newspaper to find out there's some discussions going on in this regard. I'm not privy to those discussions. I am aware they're taking place.
Senator, former Massachusetts Senator Scott Brown had lunch today with the Senate Republicans. How seriously are you taking his campaign against
I'm sure you've all heard this before, but Senator Mikulski said last week in the caucus that the Constitution guarantees every state 2 senators, but the Constitution does not guarantee every senator 2 states. Okay, so.
Senator Reid, can you talk a little bit about the schedule?
I'm sorry, I can't hear you.
Senator Coburn insurance would take care of. Is there a, for all of them, you're getting the insurance side of is there an access issue?
There's certainly an access issue when somebody who has a pre-existing disability like cancer can't get insurance. It's certainly a, what was the word you used?
Access.
Yeah, the access problem. If you have diabetes and you can't get insurance, I mean, a lot of access problems, that's why we passed the bill. And Dr. Coburn is very good at getting into the weeds and trying to find something that he thinks makes sense. But I think we need to look at the overall context of this bill. I've gone over it with each of you here today in broad form. It really brings a lot of people in from the cold so that they have the ability to get health insurance, which they've never had the opportunity before. I'm not going to talk about poor me, but everybody, it's not good to not be able to go to the doctor when you're sick or hurt.
Harry, can you talk a little about the schedule on pay equity and minimum wage?
Sure, I'd be happy to do that. Questions? Talk about the schedule. We're going to have 3 votes this afternoon. One is on an ambassador to Colombia. We have a lot of ambassadors being held up by the Republicans. Certainly Colombia deserves an ambassador from the United States. We're going to also approve this afternoon a assistant Deputy Attorney General, Calder is the name. And we're going to, what is that other vote I have on a nomination this afternoon? We're going to do Lou, who is a Deputy Labor Secretary. So we're going to do that today. There may be some other votes, procedural things that Republicans want to bring up. We're going to file cloture tonight on a number of other nominations. We hope to vote on them this week, together with finalizing the unemployment insurance. Next week, unless something goes wrong, we're going to have a vote on paycheck fairness. And it's undetermined at this stage whether we can have a vote on minimum wage next week. It's according to how much the Republicans stall us. But those are the 2 big issues we're going to move to next. Yes, I am. I'm wedded to 1010.